If you rely on opioids to treat your chronic pain, get ready for changes to how you get your prescription.
Tonight, 7 investigator Ross Jones tells us what to expect when the law changes this week.
Unfortunately, the only thing that works for me right now is opioids.
It took Lauren Kokender for more than 10 years of searching to find a treatment for the chronic pain she'd suffered from ever since a skiing accident. After trying more than 40 different drugs, it was opiates that helped her live her life.
I mean, I've been in law school, I have 2 young children, and without that, I would be curled up on the couch.
Lauren is an opiate success story, a kind we haven't heard much about lately. That's because in Michigan, much like the rest of the country, the number of opioid overdose deaths has soared. In 1999, there were fewer than 100. By 2016, there were 17 times that many. The crisis of opioid-related deaths triggered changes to Michigan law last year, designed to tighten up how powerful painkillers are prescribed. Changes that will be felt by Lauren and anyone else who goes to their doctors for opiates, starting this Friday.
The patients, I think, will see this, but the providers are definitely going to feel the effects of these laws.
Dr. Michelle Schreiber is the Chief Quality Officer for Henry Ford Health System. Going forward, before any patient is prescribed more than a 3-day supply of a controlled substance, doctors need to first consult a state database that tracks a patient's medication history.
The reason for that is to see whether or not there's risk for the patient that they're taking too many opioids or controlled substances, or maybe that they're being prescribed by multiple providers.
Checking the database is mandatory, and so is a new education program requiring doctors to talk to their patients about things like the dangers of addiction and how to safely dispose of unused opiates. That'll likely make doctor visits a little longer, but health officials say it's worth it. And for patients suffering from acute pain, the kind that will resolve in weeks or months, doctors won't be allowed to prescribe more than 7 days of a controlled substance at a time, rather than the normal 30-day course. If a patient is still in pain once the 7 days are up, doctors can renew the prescription, but only after speaking with the patient in person or by phone.
A lot of patients have gotten used to having opioid prescriptions for relatively minor pain. We won't be writing as many of those kind of prescriptions.
That 7-day cap on acute pain prescriptions won't actually begin until July 1st. Now, we should also note that officials at Henry Ford say they've already instituted tighter restrictions when it comes to prescribing opiates, and they've seen results. Since 2016, the number of opiates prescribed has fallen by nearly 20%. I'm Ross Jones, 7 Action News.
Certainly good to see. Thank you.